I was the one who pestered Maham on how to like do a community health huddle because one, I knew she had a lot of knowledge on this, and two, I wanted to figure out what exactly like my past volunteer work and current volunteer work is under community health. So to give a little bit background, I am an exec on the food insecurity team, also known as FIT, and we work a lot with food insecurity and nutrition and health education. And in addition, I also am a coach with a nonprofit organization that teaches kids life skills such as like goal setting, how to keep your integrity, how to like work to apply for like colleges and things like that while teaching them the game of golf. We kind of integrate both of them together. Maham?
So I have done some work with Dr. Daniel Price, who you guys may have heard of if you joined the Honors in Community Health. And so with him, I got to do the Community Health Worker training. And so that's a semester-long training where you get a certification. This is state certified. So then you're allowed to work as a community health worker, which is something I'm going to describe later on what exactly that means and why they're relevant. And so I also do peers beyond that. And so that's us basically integrating into the mind of high schoolers what community health is and encouraging them to start, taking action in their own communities. And so that's been kind of the experience I've had with community health. A lot of what you're going to hear from me, if you end up listening to, say, Dr. Price talk, you'll hear very similar things. So he's definitely, I call it the Pricean thinking, or so that's basically what you're going to hear. All right, we can go ahead and get started. If you're ready.
Yep. So a community is a group of people who have common characteristics that can be defined by like location, age, ethnicity, occupation, interest, or other common things. So in this case, examples of the community can include like city and the people of Houston, which falls under geography, the Asian community, which is race, seniors, which is an age category, small business owners as an occupation, the homeless as a specific problem, and like so on and so forth. The community could be as small as a group of people who live in like the first or like the second floor of CV1, or as big as like a neighborhood which is way more people. But community has like a very general definition but can apply to many things.
So here are just some of those characteristics of what a community is. And what I really want you to think about is the projects that you work in and what kind of community that you're serving. What kind of characteristics. A lot of it when we go to our community and do service is that we're saying that they have a shared need and we're trying to solve or like contribute to that need, right? And so for example, say we're doing impact, right? And that's at Cape Sunnyside. And so we have juniors or seniors who are in an underserved area, and their need would be, say, college mentorship or ACT mentorship. And so a lot of communities have very different experiences and values, and it's very hard to be a part of a community that you weren't originally part of. You guys are part of the U of H community, right? So does that kind of give you the right, does that make you part of the third ward community too? How do you guys feel about that? I may ask for a lot of input because this is a really broad conversation. What does it mean to be part of a community? What communities are you guys part of? I'll call on people or I'll sit here and wait.
For what you asked, Maham, I don't think I consider myself a part of the third ward community because I didn't grow up there. And even though UH is in the third ward, actually, now that I'm thinking about it, since I am part of a community that is part in another community, does it
make you part of that community too?
Yeah.
Yeah, so it is that is part of the question. That's like what I'm trying to get to is we're part of U of H, right? And U of H is part of the third ward. But then U of H kind of makes itself into a bubble world, but we're trying to reach out into the community and become more a part of it and integrate. But before we need to do that, we need to listen to the community, right? We're still coming a part of it. You came from a different world, and now you're becoming more a part of it. All right, let's move on.
So we're talking about community health today, and for a broad, more official definition, World Health Organization, or WHO, defines community health as the environmental, social, and economic resources to sustain the emotional and physical well-being among people in ways that advance their aspirations and satisfy their needs in the unique environment. When I first read this, I was like, what does this mean? It's a lot of words, very like long definition. So how I say it's a part of public health that focuses on the physical and mental well-being of a group of people or a set of people, and how like those different factors tie into their well-being. I don't know if you guys know this, but like when I was like looking into grad school and things like that, community health is actually like a specific thing you can study later on in graduate school that differs from like other things like epidemiology and things like that. So we will be learning more about like what is community health and how does that differ from like individual health and other things. So public health, of course, it focuses on a society as a whole and how to keep them healthy, whereas community health is like a small part of that. In our case, it would be us studying like or helping the people in the third ward, whether it be in terms of education or food insecurity. And then personal health is what I found interesting because it may be dealing with individuals such as myself, but how I take care of myself affects other people as well, such as like my family or friends. Say I'm having like really bad depression, things like that, and if I act out with around others around me, they're going to feel it too, and it will affect their personal health. Does anybody have questions about this so far, like the differences between community health, public health, personal health, or like community health in general? I saw one no, so we will keep going, Maham. So this is something that I actually found from Maham, which was really interesting, which is called social determinants of health. And reading into this, I was able to see like how what I do as my volunteer work plays into these different things. While I may not have a lot of experience in economic stability or the healthcare system, I have a lot of like experience in food because I'm helping third ward residents alleviate their hunger and give them access to fruits and vegetables that are otherwise too expensive for them to see. And in terms of education, like Impact, Smart, Wise, ATP deals with helping students with additional educational prep in order for them to succeed in life, and that will later help take care of them in like other ways. So when they get a better like into college and get a job, they won't have to worry so much about things that their parents or like other generations may have had to worry about in terms of like housing, food, healthcare. I mentioned before that I'm working as a coach in a nonprofit where I teach kids golf, but the bigger aspect of that is social integration and community engagement because these kids are from low funding families, and in terms of their like support system, they don't really have much because they're either from like foster parents or they're homeschooled and things like that. So like coming here and teaching them golf allows them to like see other kids and like learn how to interact and like get ready for the real world, because in golf you learn things like how to greet, how to keep your integrity, how to make deals, because a lot of like business deals are on the golf course. Maham, do you want to add anything on terms of like education or like any other experiences you've had for the social determinants?
So this is basically a way that puts everything into categories, right? And so you have things that somebody might have, like all of them, first they're intercorrelated, but we're categorizing them. And so that can be a benefit and a con, whatever, I forgot what the other word for benefit is. Um, but it can be a good thing. One, it's an easy way to say, okay, does somebody have stability economically? What are the education factors in someone's life? What are the food like things? And so they all, have you guys heard of Maslow's social hierarchy? Does that sound familiar? Yeah, if you've taken psych classes, essentially it's like saying you need your basic needs first, and then you kind of go into the social integration, not social integration, you network, love, care, and it increases like that. But you need one first, you probably need food, you need housing, right? But if you're paying too much for your housing, then you're not getting enough food. If you don't have literacy, then how are you going to learn more about health if you can't read about it? Or how are you going to understand your physician when he's talking about things like that? And so all of them are kind of correlated in that sense. But the bad thing about putting things in categories is that we're missing the relationships between them. And so I just want you guys to keep that in mind. This is a really this is widely used. It's a really great way to see the community, but it can be bad if we don't see how they're correlated and we only focus on one aspect.
I have a question for Daniel. If I were to like say, how does discrimination relate to like one or two of the other columns, how would you describe it as? I'm just calling out because I see his camera on.
Okay, in the future I'll turn my camera off. But regarding the question, how discrimination relates to one or two of the columns. Well, really, it's as she said, if you're lacking in one of the columns, you can't focus on any of the others that are built off of that column. So really, like as she said, food is the foundation of a bunch of the other columns. And so, yeah, it's like step by step by step. If you're lacking the basic step, all the others come crashing down.
Well, I was just wanting to see, like, in my opinion, if I was like discriminated against, or I saw someone who was being discriminated against, I wouldn't feel comfortable in terms of like going. So there are studies that show that African Americans are being discriminated against in general, and in terms of going into healthcare, a lot of studies have shown that like they do not get the care that they need. So if they're being discriminated in a social context, they may not think other people will believe in them. So when you go to other like doctors and talk about your problems, they may not believe in you, so you may not want to go. So your health is going to not be as stable as you want it to be in terms of things like that. Or if you're being bullied in school, you may not want to continue at your education. That limits you to a lot of jobs, and your economic stability may not be as good as if you continue to stay in education and you had a good support system. Let's go to the next one, Maham.
Okay, so here's where I'm going to talk about community health workers. Have any of you guys heard of community health workers? If you can like raise your hand or not raise your hand or like nod on camera. Okay, oh, so you have. Yeah, okay. Did you hear it from Dr. Price's lecture at one point?
No, I've just like heard it around, I guess. Not specifically from him.
Yeah. So the thing, okay. So you have big entities like the healthcare system, government, Memorial Hermann, and they want to go into these communities and help people. And now you have these big entities or these governmental ones that are trying to go into community that they don't really understand and tell them, hey, you have this problem. This is how we're going to fix it. How's that going to work out? So yeah, you can't go into a community or go to somebody and be like, this is what your problem is. This is how you're going to fix it. They're not going to respond well to that. So the part of the community health workers is to serve as a liaison between that community and between these entities like Memorial Hermann, and not even those, U of H, anybody that's trying to do kind of social work, but they're not really connected to these areas. The difference is that we have these giant, like the problem with these community health workers is they've always been around. You know, in Africa and all these, in every country, you have somebody in the community who's communicating with these entities, but they didn't originally get paid for this job. And so what they finally decided to do was to start paying them to give them a government certified job and to say, okay, this is your title, community health workers. And so now you exist to do this. But now it's still the big entities, those governments that are controlling them and then saying, hey, CHWs, I need you to send this message off. What we want to do is more of a bottom-up approach. And so we want the CHWs who are communicating with the communities to understand what the issues are in that community and then inform those kind of governmental entities, those Memorial Hermann, Texas Children, this is what the problem is, instead of being told what the problem is. Top down is from government to community, bottom up is from community to government. That's the same kind of reasoning that we have in Bonner, right? We don't want to go into a community and be like, hey, this is what your problem is. We notice you have, you're underserved, so you obviously need ACT help, or like you obviously need this. What happened with what Bonner, or how they built its partnerships originally, is that Kip Sunnyside, or that smart teacher, Ms. Rodriguez, came to Bonner's, came to UH and said, hey, we're looking for somebody to do this kind of work. Can you help us? And so that's one of the differences that you guys should realize with Bonner is that we don't go into a community and say, this is what your problem is. And that's kind of how we're like CHWs, is they come to us and we serve as that liaison between them and there. Part of what CHW tools are is that they do things like motivational interviewing and asset mapping. And there's a lot more other things like logic model, which is basically like a business plan. It's like, what am I putting into one of these service projects? What is the long-term goals of these service projects? So you have a lot of tools that you end up using as a CHW. And so you'll see CHWs holding diabetes education programs. You'll see them doing things like Sara-Grace with pantries, and she's serving as the liaison between U of H and Riverside Church. And so they're like that frontline public health worker that's between these two groups. Motivational interviewing is something that I've been encouraging a lot of education projects to do. And so it's something that CHWs do, is rather than, again, telling somebody what their problem is and telling them what the solution is, it's asking questions and being like, okay, so what do you think we can do? What do you think the issue lies? Where do you think that we can best help you with this issue? And so my experience was this: when I did my CHW certification, we had to practice doing this. And so I was working with, the part of what we do in the CHW at U of H is that it's both with community members and it's with U of H members. So all of us are getting our certification together. And so I was working with a teacher, and she was really funny. Okay, she's an English teacher, and she told me that when she was like 5 years old, not 5 years old, like 10, her crush wrote a letter to her, and she returned it back in red marks and corrected all his grammar. So basically, she was that type of person. So she motivationally interviewed me on, say, how I can better deal with my stress. And the difference was she started telling me how I should deal with my stress and what I was stressed about. And I was like, okay, yeah, I'm a teenager who's dealing with all these issues, rather than asking me, how I was feeling. And so that's part of what we want to do as you guys do your projects and works, is to use these kind of tools. Is what exactly is the issue? You tell me. And asset mapping is essentially when you look at a community, you will identify what the resources are. Rather than looking at what the deficits are, you're going to look what is available. Where are the nearest food stores? Where are the locations from fast food restaurants? How far is the distance? That's what asset mapping is too. And that is also something that you guys may, feel is useful, is that rather than just saying this place is a food desert, let's look at it on a map. Let's see where the locations are and let's pinpoint them. And that's basically what resource mapping is. It's pretty simple. Any questions on this?
Wait, might I add that while I may be acting as a liaison between U of H and the pantry, We do have members of the church who are acting as liaisons between the pantry and the third ward. As I am not a person who grew up in the third ward, I do not understand as well as people who have lived in the third ward, which is a big part of community health workers, because like if you're in the third ward, you understand it better than I would. I've only been working in it for the past 3 years. It hasn't been a lot of experience. And having the people at the church who are able to help us understand better how these people are feeling is so beneficial. We had shootings near the pantry before, and of course, like everyone that's a Bonner is extremely scared, but to people in the third ward, this is something that is a normal occurrence, and the people in the church knew how to calm the customers down who were coming like through that shooting, if that makes sense. Whereas we were out of our minds, like, what do we do? How do we help? Do we leave? But yes, I just wanted to add that. I am no means a helper to, like, I am understanding the third ward better, but I do not have the experiences of someone who lived in the third ward. So now questions.
No questions so far.
Also, fit numbers, that does not happen regularly. I promise no one's going to get hurt. It was like 1 or 2 times only. And it was like, we did not go through it. Everyone was safe at pantry.
So, I don't know if you guys have heard of this, but they did a study not so long ago looking at the different zip codes and how long the life expectancies of those areas, and they found that it differed almost by 10 years, maybe even beyond that. So that's something that's a really popular kind of community health research that's tossed around, and it's something that's really significant. Where you live determines how long you live. And so looking at this map, what does that make you guys think?
Are you able to pinpoint where you guys live or are from in Houston and how the life expectancy is?
Yes.
Also, for reference, we believe the red areas are the 3rd and 5th ward. Maham looked into this.
Not very well. I couldn't really find a good map of the words.
We're also really directions in like Houston in general.
One of the things that I don't want you guys to look at this map and think is, and one of my favorite Dr. Price quotes is, he doesn't want to make another poverty sucks map. And that's a very blunt way to say it, right? We don't want to make maps and be like, oh, these are the impoverished area. Look how much that sucks. Like, we want to make maps or data or do research that's actionable, that's kind of addressing the needs, rather than saying, oh, this areas are clearly impoverished. What can we do? What is actually making this area impoverished? So that's something to keep in mind whenever you do data science research, is like, you don't want to make a poverty sucks map.
So one of the reasons I wanted to do community health is because I've been trying to learn more about food insecurity and how to better help the third ward or other areas of Houston in terms of like how it's lacking food. So I applied to Action Research in Communities, otherwise known as ARC. I highly encourage you guys to apply after this year. It's been very interesting so far. I am working with Dr. Belko, who is a political science professor here at U of H, and we are working to find the connection between food insecurity and health disparities in the 5th ward. The 5th ward itself is a very diverse area in terms of education, age, racial background, things like that. And while we know that, like, if you are food insecure, you obviously may not have the means to go to a doctor or pay for medicine, we want to understand at a more deeper level how that connection is between the two of them. And so we are going to be working on conducting surveys at food pantries that cater to 5th ward residents in order to better understand that linkage between the two. Some of the questions are going to be like, how often do you go to a food pantry in a month? This way we can find out how much they are saving by getting food at a pantry. and maybe possibly what they're using those other costs for. How often do you consume fruits or vegetables a week? I have noticed personally through my time at Riverside that while we may give these people fruits and vegetables, they may not eat it because they're unfamiliar with the fruits or vegetables. I mean, I did not eat durian for the longest time as an Asian just because it was unfamiliar to me, or like the smell also got to me. And like you have to introduce things to people to make them better understand like how to eat it, why, like how it helps you and things like that. And also what diseases do you have, things like diabetes, hypertension, cancer, just so we have an understanding of like their pre-existing conditions. And are you able to afford health insurance? This is just because we know we are looking to the fifth ward, which has a wide variety of people and different backgrounds, like I said. So we want to see how many of these people, or like to what level these people are food insecure and like have difficulties in terms of health conditions and costs. And with this information, we want to help teach the people that we are researching from how to eat healthier, what to do with the foods that they are unfamiliar with, and how to, this way they won't have to be spending so much eating out or buying other foods that they're more familiar with, and how to better manage conditions such as diabetes. We have had diabetes education clinics that we host with Houston Food Bank in terms of just showing people what to do in terms of when you have diabetes, or how to watch out for signs if you or your family members may be more susceptible to diabetes and things like that. And we want to propose to larger organizations just so we can all work together on a bigger scale to alleviate food insecurity and health disparities, especially like Fifth Ward and maybe later other wards. Dr. Belko and I have agreed we want this research to last after I graduate, because we find that this is not just specific to one area. It happens in a lot of areas, not just in Houston, but like throughout the country. Just Fifth Ward in general, I believe it is the second highest county that receives food stamps in Houston. Does anybody have any questions about the research? I will also be gladly talking to you guys about it if you want to afterwards. I have been looking at like this research for a couple weeks already, and I'm learning as I go. And I would be open to like having people look into it as well and see like what I'm missing, or you have any advice. I think we can go to the next slide, Maham.
So what I'm going to be talking about in this slide is part of my summer experience. I did the Pharaoh's Fellowship, which is basically community health research that's data science driven. And so this is a lot of this is going to be based on this. And so one of the things that I mentioned to you guys before is to look at relationships between those social determinants of health, and that we don't want to make a poverty sucks map, right? And so we don't want to look at a community and just be like, oh, it's poor, it's, they have, what are some other things? Like, we don't want to say that this is an extremely underserved community. There's a lot of gun violence. We don't want to sit here and just point out everything wrong with the community without recognizing that there are benefits to living in that community too. A lot of these communities that I may be saying, like CUNY homes, they have a really great social network. And you can see everybody from the neighbors helping each other out. If I talk about where I live, there was no social network. Our neighbors never talked to each other.
You think you live in a big area though, a big lot.
That when I lived in my my neighborhood, not in the farm. We moved to a farm for reference, but even then, we didn't talk to our neighbors. Actually, our neighbors got mad at us because they thought my parents held too many parties, and they reported us. But we don't want to say that it's strong or weak. What we can do is we can look at the relationships between a community, and I'm about to show you one of the models that we use that for. And so that's going to be the directed acyclic graphs. And then here, what you're seeing is again one of those asset maps that allows you to see better what a community consists of. And so I'm just going to go to the acyclic graph, and then we'll go back to what it means to do data science research and story-driven research. And so looking at this graph, I mean, it probably looks like a giant Venn diagram model. Is that what they're called? It's just bubbles and lines. It's really not that complicated, I promise. I'm not really even sure what the colors mean. I think that the green arrow thing is an indicator. But what it's basically, this is the peers program. Now we have STEM identification, we have program enrollment. These are the things that we have to do the program enrollment. We're saying it's a scholarship opportunity. What's the purpose of this program enrollment? One, we're going to work on targeted community health topics. Our plan is to help students enhance their presentation skills and to expose them to research methods. Through this whole kind of diagram, I can see how much our program is making an impact. What is it impacting? What are the different variables that could be influencing it? The goal is ultimately, if they complete the project, one, they'll understand the importance of community health. Familiarity will lead them to pursue a career in STEM and health. So this one is a little bit more complicated looking. And we can make an easier one, just kind of like right now we can talk about it. Like if I say the impact program, which might be my biggest example right now, I'm sorry. One, we're using ACT testing as our method. What is the purpose of ACT testing? College readiness, right? Who are we impacting? KIPP Sunnyside. Where's KIPP Sunnyside? Who does KIPP Sunnyside serve? Majority African American and Hispanic students. And so what I want you guys to see is, like, by creating this diagram, you can easily see the relationships from point A to point B to point C to point D. And so this is a tool that we use a lot, because the thing is, communities are networks, right? And so when we're doing this type of research, we need to look at it like the network. We need to look at it beyond just the one research point that we're doing. There's a variety of different things that can influence that research point, confounding variables, and things that you're using to measure that research point, or different things that you can use to measure it. And so if you guys end up doing research on your projects, creating this called directed acyclic graph, and point is that it's not a circular motion. It's not always coming back to the top, even though you might feel like, oh, this eventually reaches to, if more people like it, then it's program enrollment. No, we just want to see overall what is happening from program enrollment to the end. And so, yeah, this is an extremely popular tool that's used to look at a community. Now, the next thing I wanted to mention about community research is doing things only by data and then doing things only by story. What do you think is a con for doing data science-driven research? Only looking at numbers.
Hi, this is Gabby. An issue with just looking at data is that you don't always know the reasonings behind the numbers you get, because like an area has a really, really high obesity rate or diabetes rate doesn't mean like the population there doesn't take care of themselves. It could be because they don't have access to foods or the money to get foods that will help them not have these issues.
Exactly. What is a con of story-driven research? Anybody?
You don't have the exact numbers. Like if you know what they're going through and their experience with it, you don't know how many people went, you just know what one person went through.
Both of these are really relevant and beneficial ways to look at community health research. Data-oriented will give us kind of that broad idea of, who's it affecting, but it doesn't give us an idea of the pathways. It doesn't really tell us, this person lacks food because they have a neurological disease that doesn't allow them to work, that's why they're there, which is something that's really common, is what Sara-Grace is researching, right? But then if we only hear the story, we don't know how many of these people this is affecting. So both of these researches are something that you guys can do in your projects, and both are going to be great.
One thing to note is we've had projects developed because of their noticing of data or narratives from other projects and just realizing this needed to be added into Bonner because there was an issue not being addressed and things like that. So I've talked about the social determinants of health, and you can see there's different organizations in Houston that actually deal with those like different areas. UT Health is really good for in terms of like not just like their grad schools like public health nursing, but they also do a lot of research and they work with places such as the Kinder Institute to figure out what areas are lacking in terms of like problems in community health. I've seen articles on food insecurity and education, of course, and just what needs to be done or like what is being done so people who are not necessarily in that area are being informed of how things are going. The YMCA is like one that I put down just because like I feel like everybody knows what the YMCA is, and it is working to address community health, but in more terms of social integration, whether it be some of their classes, community engagement, education in a different way. And so we also have schools, which of course obviously deal with education. I put down the COVID testing centers and contact tracing just because it falls under healthcare, but it also falls under support systems, just because of the fact that like people right now are trying to make sure how to best like deal with this pandemic, and community health workers are also helping do this right now, just making sure like contact tracing is done and helping assist at testing centers. Abuse call lines and centers help provide that support system for these people who are dealing with substance issues. And the environment is really important just because I feel like it plays a role in everything in terms of providing food, how a person is like having good connections and support systems, whether they're able to get housing or jobs, just because, well, an example would be like the third ward. The third ward is known to have environmental issues that do prevent people from moving there. And the fifth ward is known for like having environmental issues that can lead to cancer and things like that. But there are obviously more organizations and places that deal with community health in Houston. Here are just a couple just to give you guys ideas. Bonner would technically also be on here, but I figured through our explaining that was self-explanatory because everything that we do in terms of helping our students or like our customers at Riverside and helping them just get better prepared for life or helping be their support system. Does anyone have like any other places that they could think of that would be involved with community health? It doesn't have to be necessarily in Houston, because I know some of you guys are not in Houston or you're from other areas. It is also okay if no one else does. I won't call on people this time. But in general, how do you guys feel about like your understanding of community health now? Or did you guys already have some sort of understanding of what community health is prior to this presentation? Maham and I would like to know, just so we can better orientate ourselves if we ever need to present again next time, or what we can add to help cover community health knowledge.
Basically.
I think I learned a lot more. I came in knowing a little bit about the community health and what affects different parts of a place where people live. But for example, I didn't know much about the community health workers. So everything that was said today, I didn't know specifically what they did, or because it reminded me of social working. But now that you guys explained it, and provided the graphs also, it was very enlightening.
Yeah, I agree. Like, I also came in kind of knowing a little bit about community health, like generally what it is, but I feel like Maham, like the chart, it was like DAG or something where you kind of explain like all of the different factors and everything. Like, I thought that was really helpful. I didn't really see it in that way before, like seeing how everything's like interrelated. So
Yeah, also that you said that it's an actual job. I always looked at it as more of a volunteer-based thing because I know there are a lot of programs where you do it, but you're not paid. So I didn't know it was like you can go to graduate school for becoming a community health worker, and that corporate businesses like
actually undergrad, We do have a Bonner currently that's going through a Master's of Public Health to learn more about like how to be involved in community health later on in a more managerial role.
So community health worker isn't a grad school thing. I think you can do it at any age from like 16 and up, 17 and up. And it's just a semester-long program. And so it's offered by the University of Houston, and it's offered by, say, the Harris Public Health System, the training. And so it's like they send out jobs, like you're now connected through the Texas State, and they'll send you out like conferences or jobs. And like the certification lasts for 2 years. And so you have to do 28 hours of conference attending, or say that you've been working as a CHW to get it renewed each year. But yeah, it's not something you have to go to grad school for. If you wanted to do it next semester, you can.
It's also free, with U of H at least.
Mm-hmm. And so they'll do things again like diabetes education. All those little education programs is kind of what they do a lot, because those are something that they can work and cultivate to be for a specific community that they have experience with. And a lot of, like, we know that I think the Harris Public Health System for their food pantry uses CHWs as well.
But yeah, we figured that this was something that we don't really talk about in Bonner, but we play a big role in it. So I highly advise you guys, like when you're doing your Bonner work or any other organizational volunteer work, to think about like how this exactly relates to other things besides just like what you're told to do or like what you are trying to do. Because I didn't realize until like recently, like, oh, food insecurity does affect health disparities, and like these people aren't getting the attention that they need in terms of other things, and they struggle to get transportation to come to these pantries. So like, what are better options to help give them food that they may not be able to get, especially now during COVID?
And one more thing on CHWs, sorry. So they're not really for, say, those with homelessness. You have social workers who mainly work with homelessness. The kind of population that CHWs mainly work with, the fancy term for it is the ALICE one, which is asset limited, income constrained, employed, right? So they have jobs, but they're not earning enough money to fully support themselves or their family. So that's the kind of population that CHWs mainly work with.
I know there's like a lot of like younger Bonners in here, but you will see as like you continue your experience how crucial we are in like community health workers and like everybody who plays a role in just helping the people who are like under the category of ALICE, you can say. But yes, is everybody good? I know like there's a couple other people with their cameras off, so I can't see how they're doing, but I can see like the other rest of you guys, and I really appreciate that you guys. Thank you, Sam. It's nice to see you not on a cracked iPhone. I heard your meeting with Alan went well.
Yeah.
What?
He ended up spilling tea on me.
I heard that too. Alan spilled tea all over his chem notebook.
It's fine now. It's tea.
He's a good mentor, I promise, guys. I hope you guys are also able to reach out to your mentors and talk to them. Of course, senior interns are always here if you guys want to just talk about school, Bonner, or like anything else. We are just here to listen to you guys and provide friendship and sometimes coffee on campus if we are on campus.
They're quite helpful. I can say that as, am I the only junior here?
Probably.
Yeah.
Actually, no, wait, Kaylee is a junior.
Ah, that's true. I'm one of the only junior years, but Sara-Grace was my mentor. She still is. Maham is a great friend of mine. I worked with her in WISE, and I continue to admire her and everything she does. So they're very great people to work with. Overall, community health is really interesting. I've never really looked into it that much, but I've had conversations when things in the news pop up. And I think it's something that I've looked at more now, just health in general, because I did a project on it over the summer. And it's really interesting to see how different places handle it and the different factors that affect it, because some people like me come from a very privileged background where I've never had to really worry about this type of stuff, and being conscious of it, especially in the community around our university, is incredibly humbling and also important because it helps us reflect on what we have and what we can do better for our society. It's very preachy what I just said, but this is kind of how I feel.
Yeah. I mean, the main takeaways that, like, one, that was a great thing to say. That wasn't preachy at all. But the main takeaways that we want you guys to get is that, one, everything is intercorrelated, right? What you are doing is impacting much broader things. And then two, we can't tell a community what its problems or needs are. We can use things like motivational interviewing, but we are listeners and we are invited to. It doesn't mean that just because you're not a part of a community that you can't help them or be useful, right? And that's one of those things that, like, you may feel struggling with or insecure about. Is like, I can't tell somebody what their problem is, but then, like, how can, like, if I'm not a part of this world, should I be helping it? Like, do I fit in? It gives you that kind of insecurity as somebody who cares about this community, but it shouldn't take away that you do care. It just means that you need to be more of an active listener and your experiences are always useful to anybody. That's some validation.
I have learned so much as, like, from the people we are serving, as well as they have learned or, like, received from me. I feel like it's just beneficial both ways. And it's not necessarily just because it's, like, a feel-good thing, because I don't feel good when I'm covered in, like, moldy potatoes at FIT. I feel good when I get to, like, see how they are, like, able to better their lives because of, like, one small thing we may be doing.
Yeah, so we're done preaching at you, I think. And if nobody has any questions, then y'all are free.